I'm Sasha Nicole.
And I'm Star.
And I'm Dr. T.
And this is American Therapy, the definitive podcast on all things Black mental health. And we are back again. Highlight Star having the Aggie Nation in the background.
It's homecoming season, so.
I know. Have you paid attention to the people doing kind of like their virtual way of celebrating homecoming?
Girl, the outfits is the best. The whole like what I would have wore.
So we're back again as always. New show, new guest. Star, what we doing?
All right, first y'all see that Aggies do, right? Okay. I had to. I actually can't take the background down for those that are watching on YouTube. So it's actually a glitch. But anyway, so today we're going to talk about, as a yogi and a yoga teacher, I know this personally, all of us have felt like a level of tension and stress and how it lives in our body and it takes on a form all its own. So we want to learn about how to get rid of all that and all that stiffness and stuff. And so we're talking about how chiropractic care plays a part in mental health. And most of us probably don't even know what chiropractic care is. I'm just going to keep it real. I barely know. So.
Absolutely. So our wonderful and beautiful guest we have today, we have Dr. Rennes Toussaint. She is a doctor of chiropractic, mental wellness coach, and mental health advocate. Her journey includes her migration to the U.S. at age 13 and struggling to find her identity, which eventually led her on a 3-year self-discovery journey through South America. In the last 6 years, she has practiced in 3 different countries, but today what excites her the most is her Dance for Mental Health movement. Dance for Mental Health encourages women who are suffering in silence to find their identity, their voice, and to take back their power. She understands the connection of the physical and mental body and why it should not be looked at separately. Her goal is to inform, educate, and build awareness about mental health, especially within the Black community. She's also the owner of Sign of Strength LLC, a mental health awareness shop, and her advocacy with National Alliance on Mental Illness, New York, is in support of integrating mental health education in the educational system. So, Dr. Toussaint, first of all, your dancing, I want everybody to check out her dancing. It's because she got the moves, number one.
What's your Insta? Because it's lit.
Exactly. What's your Insta?
It's Dr. Rennes, RENNES.
Absolutely. So everybody go check her out and follow her. And while you're at it, make sure you follow American Therapy with a K. But Dr. Toussaint, tell us, like, one, what is chiropractic care? But two, when you mention it should not be looked at separately from mental health. Why is that? Because I definitely think that, I would have thought that they were separate before I went on this journey. So talk to us.
Right. So before I explain what chiropractic is, I want to talk about the relationship between chiropractic and mental health. We can look at it at 2 ways, right? The first way is how our emotional health, it's expressed outward. We feel it in our physical body. And then also how physical trauma, physical pain can cause increased mental health issues, right? Like the depression and anxiety. So first of all, let me explain what chiropractic is. In chiropractic, we believe that the power that makes the body heals the body, meaning that the body has a power to heal itself when there's no interferences. So for example, interferences could be physical or emotional trauma. Right. So in chiropractic, we focus on the nervous system. We know the nervous system consists of the brain, our spinal cord, and its network of nerves. Right. The brain is the most important organ in our body. Can I get a yes? You agree, Dr. T? The brain is the most important organ in our body because it really controls everything. How we talk, how we walk. Our brain controls that. Okay. So, but the brain is also protected by our skull. But in chiropractic, when we do our treatment, we focus on the spine because the spine protects the spinal cord. So the adjustment really is it's a gentle force in the spine, and there's different techniques, but the original chiropractic technique is like a force into the spine to increase movement and function of the body. Right, that's the first part. So when people are dealing with, people come to us chiropractic people come to us chiropractors for just neck and back pain. Can we agree? Or headaches, right? Those are the things that they come to us for. But a lot of times they don't build a connection with the emotional pain, the emotional trauma. So I can adjust a patient, I could treat a patient from today till next year, but if they don't take care of the emotional trauma, it's gonna continue reappearing in their physical body. So what happens in our body with emotional pain is the fight or flight syndrome, right? That's the body's natural way of fighting, the body's natural way of well, what's the word I'm trying to say? Is the body's natural way of response to danger, right?
Oh, okay.
So, for example, if you are getting chased by, if you are getting chased by a dog or a tiger, or you, a what?
The cops.
Yes, the cops, or if you're getting whatever it is, your body naturally, the brain sends the signal to your heart to pump blood fast enough to go to your muscles, so that you could run as fast as possible, right? And also what happens is you have an increased high blood pressure, right? So the thing about our brain is the brain does not know how to differentiate that real danger versus danger of like stress, worry, depression, anxiety. So our muscles and our heart rate and everything is functioning the same way as an actual danger, right? Does that make sense? So that's why stress is really a silent killer, because we just, sitting around, going to work, being in the house, and our body is just stimulated all the time, 24/7. So like I said, if we don't, I could treat patients with chiropractic care because they all come to me with neck and back pain. I'm gonna ask, oh, how's your mental health? Like, how's your emotional health? I'm like, oh, I'm fine. Right? It's like, I'm fine. People have the I'm fine syndrome. People don't want to go into like telling their business, right? But not everybody, because on the other hand, I have like, especially women, my table's like a therapy table. They just let it all out.
I'm that type of patient. I tell it all.
They let it all out because I try to create that atmosphere for them to just relax and just be themselves and just let things go. So that's one aspect, well, how the emotional pain can show up in our physical body. On the other hand, we know that low back pain is the number one disability in the whole entire world, right? Wow. So you get low back pain from anything, especially if there's some type of trauma that from one day you live in your life, you get up, you walk around, you do those things, and then the next day you might not be able to get up of bed. Imagine the emotional stress what that comes with that, right? People there, if you have sometimes associated with the low back pain or the low back disability, you have lost the sleep because because of the pain, you're not eating, you're not doing your regular functions, you're not enjoying life as usual because you're disabled. So that in itself, that could show up with people in my office who comes with low back pain. They have the emotional aspect to it. So yeah.
What level does like dehydration play? Because like I remember a couple of years ago, like I didn't realize I was like doing marathon training. I had no idea. I was like severely chronically dehydrated for like 7 months. And I had the worst like lower back pain in my life. And I literally thought I had cancer or something was dying. They did all these tests. And finally I got to a specialist and she was like, got to talk, and she was like, I think you're just dehydrated.
Yes. And it's so crazy to me. I guess because I'm in this field and I understand the importance of drinking water. I see everybody got their water here. It's just awesome, including myself. But you guys would not believe how many patients walk in my office and they don't drink water at all. Like, what? Our body's made up of 70% of water. Our muscles need water. Like, our bones, our joints need water to move. So that's, and with chiropractic too, we try to look at the body holistic, everything, not just the pain. Are you getting enough rest? Are you drinking enough water? Are you exercises? All those things that we focus on when it comes to seeing our patients.
Dr. T, what say you? We got 2 doctors in the
house. Dr. Rennes Toussaint is right. I mean, many people carry, particularly people of color, they carry their emotional pain in physical ways. And so they are much more likely to go to their doctor and say, I've been having headaches, or my back is hurting, or I'm having stomach pains, or I'm having diarrhea. And as you said, Star, they could get $1 million workup if they have good insurance and a good doctor. That's, you just got to have both.
Yes.
They could get $1 million workup, and it could be stress. And then also, as Dr. Rennes Toussaint said, there are many. I saw a patient today who has been diagnosed with Huntington's disease, and we know that Huntington's disease has associated depression and anxiety with it. So there are many physical health issues that have a known psychiatric or mental health emotional component. And so anything that you can do to help yourself physically, but also emotionally, is critical to your health and well-being.
Yeah, and that's why I try to educate my patients about that. I'm not an MD, so I can't really refer them out to therapy. So I always try to encourage them, okay, maybe you need to go talk to someone, but it's not my scope of practice. I can't refer out, but I really try to educate as much as I can because it makes a huge difference.
Dr. Rennes, when someone comes in and like you said, like I know when I go to my chiropractor, usually I'm going in there for neck and back. I had a car accident where I flipped my car over, and so I have a slip disc in my back. And so a lot of times I'm only going in for those things. But as a person who's maybe never been to a chiropractor, or, who said, is it possible to go in and say, I want you to do like an overall check on all of my bones, or, what, like, are there certain things, like, for example, I carry a lot of stress in my jaw, like I clench my jaw a lot.
Okay.
And I didn't really know it until I was getting a facial, and the lady was like, But are there things like that? Like, does chiropractic cover like the whole body? Or is it, because typically we only think of the neck and back, like you said.
The whole body, because like I said, the nervous system controls everything. So we see patients for tons of different reasons, not only the neck and back pain, people with digestive problems, people with even heart condition, breathing problems, asthma, cerebral palsy. One of my favorite patient of all time was a 13-year-old boy who was getting seizures all the time. And his mom brought him to me, and I'm not saying his seizure went away completely, but it decreased tremendously. So if your nervous system is not functioning properly, it's going to throw different things off. And the problem I think you're having here is your TMJ joint. And that's another thing a lot of people see chiropractors for.
So like you can crack the jaw?
Not really crack the jaw. Well,
that's not don't let
that's not the right terminology. First of all, you should know better.
I was just thinking out loud.
Right. It's okay. Everybody says crack, but the correct terminology is an adjustment. Okay. So what we do, first of all, with anything with dealing with the face, it could come from the neck. Even your headaches comes from your neck sometimes, because the nerves in your neck controls everything in your face. So the TMJ, we could adjust the neck and it could help the TMJ, but there is specific adjustment for the TMJ. I don't actually do it, but I know it's out there and I know it works, but there is a way to adjust the TMJ joint.
Do you ever hear that crack sound and be scared yourself? Because let me tell you something. I went one time to a chiropractor and I heard that. Now I did feel better. I'm not gonna lie. I was like, ooh, ooh, my neck felt like all open. But I heard that sound. I was like, okay, that's enough. I'm done.
It's not for everybody, right? Because a lot of people, some people love it. We say they're addicted. In chiropractic school, we used to say some people are addicted to the crack. Some people want to hear the crack all the time, and some people don't like it at all. So that's why we also have different techniques that you can use that you don't necessarily have to hear the sound.
It worked though. I'm not gonna lie, because I was like, but that I heard that noise. I said, okay, I gotta go. I'm sorry.
Right.
What's the difference between like when I crack my own neck and you adjust my neck? Because a lot of times people feel like, well, if I'm cracking my fingers or I'm turning my neck, which I do a lot, what makes it different than the way that you're going to turn it?
Man, that's a great question, because I get that a lot. And my fiance, well, he's my husband now, sorry. He does that all the time, and I always smack him like, don't do it. So what happens is if you we have vertebrae in our spine, right? So if, for example, imagine there's one in between here. So if the middle one is stuck, right, this too is going to move freely.
Okay.
So if you do this, you might move in the one that's not stuck. You might be moving the wrong bone and you keep moving it, and you don't want it to, get a hyper mobility in that joint because you're doing it all the time. I like to tell people, if you're doing it right, then you won't have to be doing it all the time. If it was the right joint, you wouldn't be having to do it all the time. So it's not, I know a lot of people say, oh, I get relief from it, but you really have to be careful, to see a professional.
What if it does it automatically? Like I just turn my neck.
So sometimes it does, because you know why? Because there's muscle tension. Yeah, we don't just have bones. We have ligaments and muscles attached to the bones. So if your muscle is really tight and you move your head, that means you need to relax your muscles, get a massage or things like that, because it's gonna keep pulling, tugging on the bone.
Ooh. Okay, so I remember like 2 years ago, my last like yoga training. And it was like one of those like teach the teacher classes. And they started teaching us about what's it called? They call it the sacred muscle in yoga, but it's the Suez or something like that.
The psoas, yeah.
Suez, there you go. I don't know how to.
That's the canal.
Suez.
I'm just glad Star said something that was silly.
But like, can you talk about like, because when I look at your dancing videos, it makes me then, and even like some of the twerking that, everybody's twerking now, but there is like a science to that. Like, that's why twerking makes you feel good, because you're like opening up that muscle, which is supposedly like connects all of your chakras and your energy sources.
Wait, you're saying twerking helps?
Yeah,
I say I don't twerk. Okay. I'm from the Caribbean, so I move my waist. That's why I say.
Your wine, dirty wine.
Right. There you go.
That's
there you go.
Weak work.
But the psoas muscle is actually attached to your lower back. Are we okay? I'm getting.
Yeah, no, you're good. You're good. You rolling. We rolling.
Okay. So the psoas muscle is attached to your low back, and it connects in your like groin in the front. So I think you're talking about the sit-in in the yoga position.
Yeah, like when
is
you
that what
open
you're
up
referring to, or just everything in general?
Like in general, well, I guess in general, like, because there's a science, like I learned it from the yoga perspective. And then I did this class at Johns Hopkins, and they were like showing like the medical piece of it, like that muscle, for whatever reason and whatever it connects, it actually, like in yoga, we call it sacred muscle or whatever, but it like literally opens up, like I've done people's classes where they only focus on that muscle. And a lot of it is similar, not twerking, but I mean, you open your crotch up. And like literally, you would leave the class like feeling like I can't even explain it. It's like it's like a compression left your body or something.
Right.
Does that make sense?
I mean, we have so many. It makes sense, but I would just say we have so many different muscles in our body that most of us don't use unless you like do yoga or go to a specific class and the trainer focus on that muscle, and you walk out like, man, I worked muscles I never knew I had. So I guess maybe that's the experience you had. But I'm sure the psoas muscle, it's a deep muscle in our back, so it helps us move a lot better. So I understand how it's connected to the yoga. You asked.
I was going to say any kind of physical activity that releases tension, is going to be helpful and it's going to make you feel good. And so whether that's dance or exercise, people who are heavy into exercise, they rotate what they do, because exactly what Dr. Rennes Toussaint said is that you have muscles that without use, they get weak, they get tight, they get, they don't function properly. And so doing different types of activities helps alleviate some of that stuff.
Absolutely.
How can we use or be more aware? And this is for everybody, especially Dr. T and Dr. T and T today. But how can you be more aware? And I have an idea of an answer, but I want y'all to answer as the experts. of like where the tension in your body lies, just being more present with your body so that you can kind of be aware of it. Because I think of like most of us, I know for myself, you're going through your day, you're really not aware of like, oh man, my neck is tight, my stomach hurts. That is not normal that your stomach hurts at 3 o'clock every day. Like these are not normal things, but we get so used to it. It's like autopilot. Like how could we make ourselves more aware so then we can address those things?
I would say breathe. Majority of my patients, all the attention is here, like you said, right? Throughout the day, just remember to breathe and breathe, release, bring your shoulder up and release it down. Because a lot of us walk around like this. A lot of people walk around like that's all that tension that they're carrying. And also in the low back. I mean, yeah, the low back is the area that most people struggle with. And even now, because we're home, we're all working from home, we're not moving around like we're used to. I live in New York. A lot of people are not walking to take the subway and things like that. So they're your shoulders and your low back.
And it's, it's one thing is just to be aware that you're not aware. A lot of what I do is bring things to people's awareness. And so people will say, oh, I don't know, I don't have any, this and the other. And I say, well, do you have problems sleeping? Oh, no, I sleep fine. What about problems falling asleep, staying asleep, or waking up early? Like break it down. And then they're like, oh, well, yeah, I do have that. And so a lot of times, like you said, Star, we become so accustomed to whatever our routines are that we don't notice when they're good or bad. We just accept them. And so just being aware, it's really, the basic tenet of mindfulness, that you begin to be aware of what's happening to you. And so it's really just helping people, okay, this week I'm going to pay attention to how my feet go when I walk, right? Is one foot always going over here? It's like, then something might be wrong in my leg. Like it's just to learn and to start be aware. Do I get stomach pains at 3 o'clock? Well, maybe you need water, maybe you need food. Like, but people just we're all in such a rush that we just lose track of what's actually happening to us.
Right. Dr. Rennes, as we begin to close out, can you also inform us? I hear a lot of people express a fear about chiropractic care. And, can you talk a little bit about like, what would you tell a person who's afraid or who feels like I've heard someone say, well, I went and then I felt worse. And I remember like I've been adjusted where that area of my back may hurt a little bit more afterwards because now, as you mentioned, the fight or flight, like the muscles that's surrounding that disc has now been loosened up when it's protecting the disc. So once my chiropractor puts the TENS unit on my back, I actually begin to feel a lot better, but I'm accustomed to understanding that. So is there something that maybe like you could say to people who have this fear or who feel like, how is that really going to help me?
Because like you said, for one, education is the key, right? If you've been to a chiropractor and if you felt like for example, you felt worse, maybe you didn't get the education that maybe after your first adjustment, you're gonna feel more pain and the things that happen throughout the adjustment and just try it. Because chiropractic is, yes, we focus on the spine, but there's so many different doctors with so many different specialty, but our goal is all the same thing. We all have the same goal, and the goal is to help you function better. Like I said, if you had a bad experience, try another doctor. Talk to them, explain your experience. Maybe they'll do something different. We cannot treat every single patient the same way. Everybody's body is different. Their type is different. Their pain threshold is different. So don't be scared. Like I said, we supposed as chiropractors to focus on our whole holistic, the whole body, and not just the pain. And go say like, just get checked up. A lot of especially our physical trauma accumulates over the years. I've seen people who had car accidents before, like 5 years prior, and they come to me. I was like, oh, did you have any accidents, trauma before? Oh, I was like, oh, I had a car accident, nothing happened, I'm fine. I'm like, no. What you're experiencing now could be a result of what the trauma you had like 5 years ago. So just go get checked up. You don't really have to have pain to see a chiropractor. We could evaluate even like our posture, for example. A lot of people have posture, even kids. Oh my God. I do not want to see this new generation. I mean, I'm not that old, but I don't want to see the new generation a couple of years with their posture in the neck, because everybody's looking down all the time. So especially if you're a parent, you could even take your kids to get this spine checked, and it's for everybody. We see from babies to 90 year old patients. So yeah.
Dr. T, what's your last thoughts about this holistic form of care?
My last thoughts is always to be open. Yeah. And nothing works with one treatment, right?
Yeah,
There's no form of healthcare, taking care of yourself, that works in one treatment. So be open and don't just, I'm saying all the time, Google stuff, but don't Google something and then think you're an expert. So if you're really interested, then do seek out a professional opinion, learn something about it, and decide if there's things you can do. But be open. All of our pain is expressed in so many different ways, and taking care of ourselves, where our roots come from in the African continent, we have had many different types of holistic care for generations and generations and generations and generations. So we don't have to be wedded to Western medicine. And I, even as a practicing psychiatrist, I don't use medicine all the time, because there are lots of other things that people should try first. Yeah. Medicine is one tool in your tool bag, but be open to things that can help you. And as long as you are taking care of yourself, you're sleeping well, you're eating well, you're releasing that stress and tension in your body, you're going to continue to get better.
Yes.
Absolutely. Well, Star, what say you?
Right. I got my two things. So two things. So first, Dr. Toussaint, thank you for coming. This was wonderful conversation, like very informed, and I may try, chiropractic care again. I probably have to put some headphones on or something.
Whatever works.
I was like, I gotta go. I'm sorry.
Whatever works.
But my first thing would just be, there's a great exercise that a somatic meditation exercise for beginners to kind of start to reconnect with the body. And it's just simply laying on the floor. You don't have to be ultra still like you're dead, but just trying to find a position, a comfortable, still position on the floor, laid out, and then just see and do like a body scan. Mentally scan your body up and down, from toe to head, back from head to toe, and then just take an mental inventory of all the sensations and the feelings and where there may be pain. And it's almost like a inquiring on your own body. And that's always really good to kind of get people back, especially people who have gone through like trauma of some sort, physical or sexual assault type trauma, because those types of folks often have trouble reconnecting back to the body, and you want to do it in like a really safe way so that they can do it for themselves. So that's always a good exercise to do. You can do by yourself, do it at home, close the door, maybe lock the door because you don't want people walking in while you laid out on the floor. And then you can take that information and you can take that back to your wellness practitioners, your psychiatrist, your medical doctor, your chiropractor, and that'll give them more insight on how to help you on your process. And then the second thing is, the body is all connected. It's all, now they're saying you got a brain in your head and your stomach or something like that. So everything's all connected. So you have to nourish like every part of the body. And so this was a beautiful conversation around, we talk a lot about like diagnoses and stuff in the mental health space. This is a very beautiful connection of the two. And check out Dr. Toussaint's Insta, because it's lit. And like, I love the dancing. I was just like, oh my goodness, let me get up and dirty wine. Thank you.
Thank you.
Absolutely. To piggyback from Star, thank you, Dr. Rennes, for appearing on American Therapy. We always appreciate it, and thank you for coming. I think I would just close out and say, you know, we had a show with David McCullough, who is the owner of Inception. And one of the things that we talked about was that in our community, we are slightly behind, and maybe slightly is modest word, but we're behind in terms of the holistic care, even though, as Dr. T mentioned, our roots are from holistic care, you know, and we've lost, as Dr. T has said on so many of our shows, that social fabric where, you know, we're missing our history and just our togetherness. And I think, you know, I would love to see and encourage more people, especially Black people, to get on the train in terms of taking care of our mind and our body in ways that go beyond just the doctor's office or just the medication. I religiously do chiropractic care and acupuncture, and it's helpful. And I take my daughter, and, you know, there are people who do take insurance. If you can't afford someone who doesn't take insurance, you know, you just have to search and look, but it's a great start. And I just want to encourage people to just be open, as Dr. T mentioned, and piggyback on, and just try it, give it a try. And you would be surprised in the ways that your body starts to respond differently, and the way that, as Star even mentioned, the way that you even start to pay more attention to the things in your body. So with that said, American Therapy, follow us everywhere, American Therapy with the K. We love you, thank you, and we out.
Thank you.